you don't need to have embedded in the EHR elements of capability to do specific functions, such as care coordination, such as patient access. For instance, what are my examples here? Suppose you had a registry function, and the registry function was not a part of the EMR. It was actually outside of it, and it connected to it. It communicated with the EHR, but had the capability with a much lower acquisition cost to be able to give you population and disease analysis. That with your registry, you could push a few buttons and you could get a report on all your patients with diabetes, or all your patients with asthma, or all your patients with COPD. Plot a graph very easily on a screen, print it out, do whatever you needed to do with it to show you over time how your population of diabetics is doing with metrics that you've defined as value and quality, and then annotate it, is runtime analysis, annotate it easily with a point in time where you might have changed something in your workflow with the team, and then track how that impacts how all your diabetics are doing by just pushing a few buttons and getting a report. While at the same time, that registry function, which had access into it by a portal for your patients with diabetes, for instance, they could see how they're doing, each of them over time, with the key metrics around diabetes, typically things like hemoglobin A1C levels, lipid measures, blood pressure readings. They could track their own against the total population and aggregate score, and it's a great tool to motivate the patients, light a fire under them, get better results, while our teams can use the same data easily. Maybe that's the first thing you want to think about if you already have an EHR deployed. Find a registry, get access to it inexpensively, and then you could build it in a method we call a bolt-on to the EHR. In other words, it sits as an icon in the workflow off on the side of the screen as you're working through patients and using whatever EHR you have. And when you want to use your registry function, you click on that icon, one click, it takes you to the registry software, and then you can do whatever you need within it, and then get back into your EHR as you see patients. The key element of connecting those two is the ability for that registry function as a, quote, bolt-on to the EHR in the process of what you deploy. The key element is being able to transfer structured data back and forth. Often it's an add-on, and if it's done through the vendor of the EHR, often it's expensive, slow, and difficult. Imagine if you could pull things off a shelf and build those capabilities to what you want, to what is driven by what the patient needs and wants, and it was much less expensive, and it communicated in a way that fulfilled meaningful use criteria. That's your target.